Happy Sunday, everyone, and last day of National Public Health Week, but definitely very happy to continue to celebrate public health every day this year because I think it's important. I loved the turnout for National Public Health Week this year and the conversations. I feel like there were so many people sharing into the conversations and talking about the topics. And here today, we have a wonderful expert panel to talk to us about the future of public health. So just to give a little grounding of the conversation before I let the panelists introduce themselves, public health has had successes, failures, and struggles over the last 4 years. The public health landscape has gone through many shifts since 2020. The public health workforce needs 80,000 professionals to fill their needs gap. Public health still does not have direct loan forgiveness programs. Public health seems saturated and challenging to enter into. Public health has been a hard market. Public health has been hard to market, especially when things are going well. Yet public health is vital to population level health improvement. We must share the value of public health in and out of crises. There is no one right path to ensuring that the future of public health is adequate. From recruitment to public health programs to early professional jobs to mentorship to pathways for career growth, there's a lot that needs to be done. How do we envision a future where equity and diversity in public health is central? How do we better communicate and market public health? How do we ensure the future workforce is diverse and matches the community's need? While we won't cover all these topics today, these are the kinds of thoughts that we have to have when we're thinking about the future of public health. I am so excited to be joined by the wonderful guests today. And before I get into introductions, if you're joining on YouTube, be sure to hit that like button. Be sure to share this with someone so that they can get some value from the conversation. And as always, ask any questions in chat and I will ask them when it feels appropriate. So to kick us off, I would love each of you to introduce yourselves and tell us how you are showing up today.
So I'll go first. I am Dr. Desiree Strickland. I received my doctorate at Florida A&M University with an emphasis in behavioral health and health education. Currently, I am the CEO and founder of Strickland Health Consulting, as well as Young Black Professional. I provide a lot of health equity focused consulting to various organizations. And Young Black Professional, I do a lot of career development, career coaching for young minority professionals, not just in public health, but in a lot of different areas. So I have a podcast doing that, as well as I just launched the Public Health Club earlier this year. So it is a space for public health professionals of all ages, all spaces that you're in your career, to join, get some career advice, consulting advice, and just network. And I am showing up in a great mood today, definitely excited about this conversation and to be on this amazing panel. I just got finished grocery shopping with my 2-year-old, so that was fun chasing her around in Target. So I am energetic right now. So I got a lot of energy built up. So I am ready to get started and just excited. So thank you for having me in this space.
Thanks so much. I guess I'll jump in next if that's okay. I'm Heather Krasna, and I am a public health workforce researcher and advocate, and I'm the Associate Dean of Career and Professional Development at Columbia University Mailman School of Public Health. And my doctoral degree was on the topic of employment outcomes of public health graduates and labor market competition. So I can very much nerd out on things like public health workforce, job market, all the different angles. And since then, I've been doing research on salary differentials between people who do public health jobs in local and state government versus people doing those pretty much same jobs in almost every other sector. And you can all guess who gets paid more. I'm not to do spoiler alerts, but it's like, unfortunately, a lot of times government, local and state especially, doesn't always pay as much as you would hope. Although it depends on the occupation. There are a few occupations where you actually get paid more in government, believe it or not. Anyway, I am very passionate about public health. I am also the co-author of the book 101 Plus Careers in Public Health, the 3rd edition, which is the only book in print in the US about public health careers. Anyway, I enjoy talking about all these fun topics. I just got back from a picnic in Prospect Park, Brooklyn. And so it was a beautiful day with beautiful flowers. And so I still kind of going with that vibe. Thanks for inviting me.
Thank you, Desiree and Heather, for that introduction. And Amari, thank you for bringing us all together to have this conversation. I'm Aaron Carpenter, and I am a policy associate at the Robert Wood Johnson Foundation and a recent graduate of UNC Chapel Hill's Global School of Public Health, School of Global Public Health, concentrating in health policy and management. I'm also the co-founder of Brothers in Public Health, where I serve as the VP of Research and Advocacy, as well as a practicum advisor within UNC School of Public Health. Really, what brings me to public health and keeps me motivated to do the work is just really my lived experience. I'm, a Black Jewish man from the rural South. I've seen very much so firsthand the disparities that exist in rural areas and in communities of color. Really excited, as an early career professional to provide the lens that I have on the future of public health and to continue in this conversation.
Thank you all for the introductions. And I think everyone that's listening would know that we have a wealth of knowledge, a wealth of experts on the call today, and a lot of different things that we can dive into. And I think the broader conversation that a lot of people are having in public health, it kind of speaks to Desiree starting Public Health Club, is people want networks to build relationships, to find out how to get to that next step of their career. And I know I've had a lot of conversations with Aaron around his graduating from his MPH program and then staying in an internship because a lot of the jobs that he was getting offered just weren't good fits for what he wanted in his early stages of in his career. And as you heard, he is right now a policy associate at the Robert Wood Johnson Foundation, which is a huge organization. And I think kudos to Aaron, because many times when people are in a position where the back's against the wall, they might bite for that first job, even though it's not something that fully fits what they want in their career. So I kind of just want to start off there and hear that thought process of you graduating from your MPH, looking for the next position, and then the journey to getting your current role.
Yeah, I also want to acknowledge first how I'm showing up today. I'm showing up very energized. I'm very excited again to talk about the future of public health. Amari, to your point, I think for many people graduating, the job search is really difficult. It's really trying. It wears on frankly, it wears on your self-esteem at times. I think I also want to acknowledge, I think I kind of had the privilege of being able to spend some time at home and limit some of my expenses, which not everyone has the opportunity to do. So I think that made the search a little bit easier. But I think throughout the search, I really kept, the fact that I was looking for specific types of roles with specific types of teams in mind. I think additionally, I really tried not to take to heart any, declined roles that I received or offers that maybe were not what I was looking for. I think one thing that I really would, suggest that people keep in mind is that it's really easy to accept, the first job offer, the second job offer you receive because you feel like you might not have the opportunity to get something else. But really, I think from my perspective, applying and channeling all of your energy into applying to fewer jobs with a more specific cover letter and resume is really going to get you the best opportunities. And a lot of times, and even being a practicum advisor at UNC, I've noticed that a lot of students will throw the same resume or the same cover letter with maybe a few things tweaked on a job or at every job they're applying to. And that can be seen truly, teams know when you're sending them a generic cover letter or resume. I think procedurally applying to jobs, I also would say, making sure that you have mentorship and sponsorship, having not just people who are willing to talk to you and help you acquire skills or network, but also willing to, make connections for you or speak your name in a room are really important, in moving into, new roles and, getting introductions at places that you're interested in. it's really trying. It is a really trying time to be out of grad school applying to jobs, especially right now.
I appreciate you lifting that up. And that is the same sentiment I hear from many people out there. And I feel both Heather and Desiree, if you all would like to add to the conversation, because I know you're also working with many early career professionals that are looking for their first job or looking for that early transition in their career. Would you like to speak more to that?
Yeah, I think everything Aaron said was spot on. I think that, I'm a podcast junkie, so I listen to podcasts like literally every day. I was actually listening to one earlier today, and it was a financial podcast, and they said that the average salary needed to live comfortably in I think it was a study done in 99 of the largest cities in the US was for a single person was $93,000. And I was like, wow. And of course, that varies, of course, by city to city, but, just kind of thinking about that and thinking about the expectations that I think that recent graduates have of, matriculating into the professional world. I don't think that we are preparing them fully for those, expectations to really kind of to Heather's point, kind of looking at like the local health departments and the state health departments and what their actual salary ranges are. So when we're applying or when they're out there applying for these jobs and they're like getting offers of like 40,000 or 50,000, they're like, what is this, And I do think that, there does need to be an expectation set for them to know that, okay, this is the landscape of public health. But I also think what Aaron said about getting very specific about his job search approach, that is so key. That is one of the things that I see all the time, and not just in public health, but in a lot of different fields too. And especially since public health is so broad, it's so many things that you can do. It's hard to just kind of like, or not even hard, but a lot of people just kind of like, oh, I just want any job, I just want anything. And they're applying with the same resume, the same cover letter, and not understanding that, if you want a health educator role, you can apply with a data and analyst type, resume. So those things are going to be totally different. What the employer wants are going to be totally different. So I think that getting very specific and then only applying to those jobs that are really specific in that area. And the more you look, the more that you will find those that kind of resonate with what you actually want to do. But you really got to keep looking. And again, to what Aaron said about you have to have a mindset shift when when you're going from being a college student to a professional. It's a mindset shift that you have to have. Like you're no longer and granted, you should always be learning, but you're no longer just in the learning phase. Now you're in the phase of you are a professional. And a lot of times people don't have that connection that, oh, now I'm a professional. So they're still kind of thinking with that college mindset, but we don't have guidance a lot of times to get us to that kind of next level of thinking. So I think that that's important, just kind of preparing your mind for that shift, and then also preparing your mind to get rejections, to get no's, and realizing that you only need one yes. All you need is that one yes for that specific opportunity that you want. And the no's are okay, because in my head, when I get no's and rejections, which I get all of the time, no's and rejections for things, and I'm just like, well, that was God protecting me from whatever it may be, and something better is coming. And honestly, like something better has always came. So I think that I see the same things across disciplines, across just different areas, the same kind of feelings. I see those same things just often, but it's definitely a formula to kind of getting through it, and to kind of finding a position that you are going to like.
Yeah, I just want to chime in and resonate with what both of you said. And just from the point of view, I didn't really say this in my intro, but I've been a career counselor and career coach for 25 years. And I've read so many resumes and so many job descriptions, just so many. And I will say that there are some sort of hacks that can help. And I will say that it's true that being focused is really smart. Making sure your resume and cover letter are tailored is absolutely correct, because a lot of employers use an applicant tracking system, and now there's machine learning and all that fancy stuff. They can look for the right buzzwords. So you're 100% right. You do need, if you have two different types of goals, you probably need two different resumes. There is something to be said for volume also, not to say you have to kind of balance the quantity and quality at the same time. And so I also just tell people, when in doubt, go and apply for the job. I work with so many people that have a little imposter syndrome, or they get worried, oh my gosh, I don't meet 100%, 120% of the job posting requirements. If you meet 60, 70%, just go for it, because I say to all my epidemiology students, what are the odds of getting the job if you do not apply? Usually zero. I always say usually zero, because maybe your cousin or somebody owns this company, gives you a job without even applying. But usually the odds are zero. So you improve your chance by trying, and don't be scared of that rejection. It's going to happen to the smartest, most wonderful, awesome, giving, loving, amazing person. They're still unfortunately getting rejected. The other thing I just want to give as a perspective about what I've seen, because people do ask me, like, what do you think is going to happen in the job market? I'm like, I don't even know. That book, 101 Careers, Omar, you were in that book. It used to have a chapter called The Future of Public Health. And we revised that book in the middle of COVID. And I was like, listen, we're deleting this chapter, because I don't even know what's happening 5 minutes from now. This is COVID time. I don't even know. Forget it. The minute I write anything, it's going to be totally out of date. One thing I do want to say that I have seen just in the last year or so, though, is something that might help people feel a little bit like more that you're not just making it up in your mind if you're seeing more rejections. This is not just that you're feeling like this is hard. There's actually, in my understanding, there's actually reasons for what's happening in the public health graduates job market right now, the class of 23 especially. What I saw, and I think this happened nationally, is that a whole lot of people, like in fall of 2020 or maybe 21, were like, wow, public health, COVID is happening. Everybody's going to need public health graduates. I just got laid off from my job because there was a closure because of COVID. I don't have anything else to do. I'm going to go get an MPH now. Well, that meant there was this huge increase nationally of people getting public health graduate degrees. And guess what? They all kind of ended up graduating, at least for us, in like summer of 23. Guess what was also happening at the same time? So here you have a big supply of people with good training in public health all at once, just swarming the markets, at the exact same time that now there's no longer a COVID emergency. All that funding has gone into thin air. A lot of the funding that had been out was gone. A lot of people who had been hired temporarily to be contact tracers or to do COVID response, those people were all also on the job market. Those grads from class of 2020 and 21 were suddenly job seeking because their money ran out because the COVID emergency was over. So I had been so optimistic, like this could be the greatest job market ever, forever. And unfortunately, the memory of our country and decision makers who have the budgets for public health is super short, like unbelievably, sadly short. And so you had more people looking at the same time that there weren't as many jobs because the funding wasn't as much. So I really do feel like there's actually external factors that make the job market a lot tougher than it was maybe for the class of 2019 or even 2020, which was totally messed up from COVID. But even that class, people did get jobs. So I feel like there's bigger picture stuff, which just means, like everybody said, you might have to try harder, be more focused, not give up, keep on applying. Networking and building relationships is so crucial to all of this. That's actually the game changer for most people, is not just apply randomly, but like build a rapport with people at your favorite organization over time. That's really how you build those relationships that get you more job interviews, that get you more jobs. I know I said a lot, but it's not in your head if you feel like it's a harder job market. At least class of 23, I feel like was hard for a lot more people than I had seen for a little while.
I'd like to just circle back to something that I think you both highlighted, in that I think many graduates are really surprised when they start applying to jobs and then receive the offers that they receive, in terms of compensation. And I think one call to action that I have for the sector is just pay transparency. I mean, there's so many jobs you look at and the range is ridiculously wide, right? So you go in, you get an offer, you're not sure what to expect, or there's just no range at all. I think additionally, one thing that I would definitely suggest, those applying to jobs do is to know your worth, know a number you're looking for, right? I mean, I declined a few offers because they were not in the range I was looking for, or tried to negotiate and realized that there was very little room to negotiate. And quite frankly, the time you have the most leverage is when you're being brought on into a role. So if there's no room for negotiation, then there's likely not going to be later down the road. And so I would say just keep that in mind. And yeah, apply to jobs that fit your criteria, you know.
And I would just to add to that, one thing I tell a lot of my clients, a lot of the people that I talk with is go one state that does pay transparency pretty well is Colorado. So go look at Colorado jobs. They are legally required to post their salary ranges. So I always tell people if you want an idea of how much you should make or how much other places are making, and granted, like I said earlier, it's going to vary by city to city, by state to state. But it gives you a good idea of what to look at. And then I also wanted to add too, I think that one thing I have noticed as well in public health, I don't think we do a great job with naming the jobs that are posted out there. Like, public health analyst could mean 100 different job duties, right? So I think that just kind of making sure that you are thoroughly reading the job description, and then also understand that if you're just kind of starting out in public health, sometimes you have to take something that's going to really get you that experience that you want. So I think that a lot of times, yes, we want the pay to be amazing, we want it to be great, but we also have to think about what type of experience can I get from this particular role. Because the first job that I had coming out of, or not even like, it was before I completed my master's, the first job that I had in public health was at a state Department of Health in Florida, in Tallahassee, Florida, and the pay I was making $36,000 a year. And, for someone that had never had like a full-time job with benefits, I was just like, oh, okay. And then, a month in, I was just like, oh, paycheck. It's not correlating. But, I didn't know a whole lot back then. But I will say about that position that I had, I was the program manager, I was the evaluator, I did GIS, I was able to go present at a lot of national conferences and state level conferences. And yes, I got to wear all these different hats and I got a lot of responsibility, but those are things I still talk about today, those experiences that I had. And I was able to build an amazing network and just grab some amazing, amazing skills that otherwise I would have never grabbed. And I know that, it can be appealing, especially like when you're thinking about larger organizations like CDC, but, you have to think about it too. Are you going to get that vast array of experience? But also just kind of knowing when to get out too, because after you get your experience, you deserve more money. So, knowing when to leave is definitely a big deal, and just kind of understanding that. But I would say, don't shy away from the lower paying opportunities because they are out there. But think about it in a way of what can I get from this opportunity? How can I leverage this to really help me go further in my career?
Totally, totally right. And I just want to mention really quick that like I feel like I'm such a Gen Xer. Back in my day, it was really hard to get salary information. I had to just say that I'm like probably the oldest one here. So I'm like back in my day. But anyway, these days though, it is actually pretty easy compared to how it ever was to get salary data, whether that's pay scale, salary.com, Glassdoor being one of my favorites. I love Glassdoor. And you're exactly right. There's a couple of cities and states now that require some kind of salary, although there are people who fake it and they're like, this will pay between $3 an hour to million. And it's like, can we be real? But New York City does require salaries to be listed. And I think for every job, even if you might live in New York but work remotely some other place, that you still have to list a salary for New York. I believe that anyways, it's just way easier to get at least a range. Even this is nerdy, but using the US Department of Labor, the Occupational Outlook Handbook, or ONET Online, that gives you at least a clue of like, how much does an epidemiologist make? And, all of these data sources give you some sort of framework to work with. So anyway, I just always recommend researching that and then looking at the whole picture of that job, just like you said, whether that is that they're giving you mentorship or this is a job where you're going to be able to have a big impact at a sort of early time in your career, and then you can leverage that going into your next role, whether that's a promotion or you're switching gears. And I just want to add one other thing is that what I was saying about public health job market being kind of rough. The flip side of all of that is that public health is really flexible. That's the thing that I've observed, is that the skills people get in public health, from a degree in public health, are really, really in demand in so many different areas that you would be amazed, right? And people, half the time they're getting a degree, let's say it's epidemiology, an employer may not even know what that is. But when you start explaining, hey, I can do some statistics for you, I also know how to write and I know how to talk to people, suddenly they're like, wow, that's exactly what I needed for this totally unrelated job you never heard of before. And guess what? You have the skills. You just, maybe the employer doesn't know. And so you have to explain to them what it is that you actually can bring to them from your training. So anyway, just some other notes.
I'm loving this conversation. And we do have our first question in the chat. As you're coming in, be sure to like and share this with someone who get value from it. And leave a question if you like. And I think the question like kind of just goes off what you were just saying, Heather. Like, is an MPH worth it? That's a question that someone asked.
So I shouldn't even really answer this because I don't work in admissions, but I do work at Columbia University School of Public Health. And I, of course, am very biased. And I think that a graduate degree in public health is a fantastic investment. Everybody has different things to keep in mind when you're deciding what to do, whether you're going to go for another degree or you're going to jump into the job market and get some experience, maybe get that degree later. You kind of have to ask a lot of questions for yourself, whether that is, what I would basically say is when you're choosing, let's say, should I go for this degree? Talk to some alums from the school that you might think about going to. Of course, look at the classes, look at the geographic location. The number one thing people forget to ask, in my humble opinion, again, I'm totally biased, do they have career services for their students? Do they have a career services office with counselors, with training and credentials in career development and career assessment, who also understand the public health job market and also understand all the weird government resumes you might need to create, or all the different, there's so many differences within the market. Or is it like there's some general career services office that serves the whole university, but they don't know anything about public health? It's kind of helpful to have some people that really know what they're talking about. And of course, I know like all my colleagues in other schools of public health, and of course, I love them all. They're all awesome. So it's a very small, tight-knit community of career services folks in public health schools, but not every school even has somebody whose job is to help you find employment. And it's really important, and you're paying the tuition, you should get that service along with it. So that's one of the big questions I would always ask if you're choosing where to go to grad school.
And I would just add to that, is it worth getting an MPH right now? If you want to go into public health, then yes. Like, I think that it's just a simple answer. Yes, if you want to go into public health. Now, I have heard so many people say like, oh, you can't make any money in public health. And, my response to that is, no, you can't make any money in public health. There's plenty of money in public health. So it's just a matter of, a lot of times it's who you know more so than what you know. A lot of times, just I think like Heather was saying, like, you could have a cousin or someone that's the CEO of a company and they could just bring you on. But, it could happen just like that. Or, somebody, you meet someone at APHA at a state level health conference, and then bam, now you have a job. So, it could literally happen that fast. I've seen it happen that fast before, from just your connections. But I definitely think that getting an MPH is worth it if you want to go into public health. And if you know that you love this field, you want to do the work, you're going to do excellent at the work, you're going to achieve, what you want to achieve, then yes, go for it and get an MPH and go all the way.
Thank you for that. And yes, I would agree. An MPH is with it. And even just to the point that the skill sets that you gain and the perspective of how you view life and health, I think is very unique and can be plugged into so many different places. So Heather, I'd love you to highlight the importance of the student loan forgiveness program, the one that is specific to public health people. I know you've been advocating for it online for a while now, so give us some context and tell us why is this important?
I could go on and on, but I'll try to keep it short. Thank you for asking that question. So some folks may already know about the Public Service Loan Forgiveness Program, which is, in my mind, a really awesome program, but it has some flaws. It's been challenging for some folks to get their loans forgiven. There's also the challenge with that program, and I'm not a super expert on every part of it, but it's you have to work in either nonprofit or government for basically 120 monthly loan repayments, which basically is 10 years before you get any of your loans forgiven. So I'm so glad that program exists, but it is missing something which is needed for the public health workforce. So you said this right at the beginning about there's 80,000 people needed to replenish our local and state, especially our local, state, tribal, and territorial public health departments. It's probably more than that by now, actually, but that number is based on like how many public health professionals you need to keep a community healthy, how many people quit because of COVID burnout, and a lot of people retired and quit during that time because it was so stressful for health departments. So the thing about the Public Service Loan Forgiveness Program is that it doesn't give any sort of an attraction or incentive for someone with training in public health to go and work in the places where they're needed the most, which is the backbone of the public health workforce, which is local and state, tribal, and territorial government. If you don't have folks in those roles in health departments, then the whole public health infrastructure can start to crack. And that's what we saw during COVID, is that we did not have the frontline people whose job was to provide the essential public health services, because those health departments had had budget cuts going back to the 2008 recession, and they never replenished those jobs again. So they were short-staffed already, and that's why the United States, one of many reasons why we saw such a disaster with COVID. So we know there's a workforce shortage, and there is a very proven track record of closing a workforce gap by creating a special incentive for people to choose a job in a particular type of employer where there's a shortage. And so there's been this, so just so you know, for 50 years, there's been something called the National Health Service Corps program. This is a great program. I'm not knocking this program. It pays back student loan debt for doctors, nurses, physician assistants, dentists, social workers, mental health counselors, like all of these clinical positions. So if I'm a doctor and I go to a very, what they call healthcare shortage area where there's not enough doctors, I can get a chunk of my medical debt, medical school loans repaid. And that's been proven to work, to get people to move to maybe locations where it's maybe more rural or just there's not as many resources. And so that program works. There's never been a program equivalent to that for people with public health degrees who go to work in public health departments. There has been legislation in 2006 and also 2010 and also in 2022, each and every time, to create a student loan repayment program for people with degrees in public health, specifically, who go to work in those workforce shortage areas of local and state health departments. And it's never gotten any funding. So we've been, because of this issue, I'm a co-founder of an organization called NAFSA, the National Alliance of Public Health Students and Alums. NAFSA, you can go to visit naphsa.org. Anyhow, every year we've been trying to, bang on the doors of our elected officials to say, when are you going to fund this program? Our health departments are really short of people. We have these incredibly smart, awesome people with really good training that is uniquely designed specifically to go work in a health department. But there's no way to really attract them because these jobs, like I've discovered, they sometimes don't pay as much in those areas. It's sometimes rural areas. Sometimes the whole hiring process takes forever, which is a whole other conversation. So we're keeping at it. I'm not giving up on it. It could take a while. I've learned the hard way. Advocacy efforts like this can take a really long time. But I do feel like if people want to make that happen, they can get involved with our organization and start advocating for this program to take place. Doctors and nurses, like, they knock on their elected officials' door every single year the doctors show up. There's this organization, the American Medical Students Association. They show up in their white coats, okay? They got their brand figured out with their white coat. They show up and they're like, well, you need to fund the National Health Service Corps. We don't really have that for public health yet. We have a little, we're starting to grow that. But I would just encourage everybody who's interested and who's considering public health degrees to try to advocate for it. I'm glad to talk about this all day. I don't want to take the whole, I could totally take this whole conversation, but I don't want to do that.
I think it's important that people know about it because I've seen it being posted online, but I think it is such an important conversation to have. And like to your point, it creates that incentive for many people to go into state and local health departments to do that work, to build that experience. So I hope that this is something that can get passed so that can support a lot of people in the public health field. And I think it kind of goes back to many times in public health, we want to save the communities, but many times the communities aren't being saved by people that represent them. So how can we get people representing the community into public health? This is one way that we can really support that kind of pathway. So I appreciate you raising that up. Desiree, I'd like to move on to you. So you've done extensive work providing the foundation for professional development for young Black professionals. How do we position individuals to take advantage of the best opportunities for their career success?
That's a very loaded question. So I think the first thing that comes to mind as I think of that question is one, something that Heather kind of touched on is the the lack of people taking advantage of their career services within schools. And I think that that's huge. And then also I never thought about it, but a lot of schools do not have public health specific career services. So they're just very general. And I've noticed that in my career, it was very general career services. It wasn't really giving me an overview and that insight into what the landscape of public health is career wise. Even like, what should my salary expectation be if I want to go into epidemiology? Or if I want to go into health education, what do those type of careers look like? That could be like a number of different careers if I want to go into health education. But just kind of having someone there to really guide me and to say like, okay, this is what's out there right now. These are the different titles you should maybe search for. I get a lot of people that I talk with that they're searching for jobs and they can't find job opportunities. And it's because they're just typing in public health in the search engine. So it's just like simple things like that we can kind of direct people to. But I think that a lot of universities aren't putting the need for that in there. And I created a online course called Recent Grad Bootcamp. And basically it takes you through, as a recent graduate, it takes you through literally everything. We focus on the mindset shift. And then we go into your resume, your cover letter, developing a digital portfolio, showcasing some of your work that you've done, whether it's in school, whether it's through internship, whether it's through volunteer work, doing that. And then also it takes you through, okay, now the job search process. How are you going to kind of throw your resume out there to get opportunities? Then through the interview stage. And I think something like that should be implemented into schools before they graduate. So they should be required. I mean, and this is a thought that I had like a month ago, and I was like, this would be really great. But like a course like that should be required before you even graduate. And then like, the homework at the end should be you have to apply to such and such amount of jobs. And then, hopefully the goal is by the time you graduate, you have a full-time position, because you have someone there that's dedicated and a course that's dedicated to helping you actually apply to jobs and get out there. So I think that that's one kind of call for schools of public health and universities to really put that emphasis on career development and really putting resources into helping their students actually obtain jobs after they graduate. And then thinking about too, as students kind of, like I had said earlier, kind of matriculate into the professional world, into the professional settings. The reason I started Young Black and Professional was because when I got to a point when I was at the State Department of Health and I decided to, okay, I can take interns now. I specifically wanted Black and Brown interns. I wanted to make sure that I was reaching into like our minority populations, thinking about the BIPOC populations and everything. And bringing them in. And the thing that I noticed was that the Black and brown interns were not as prepared as a lot of the white interns. And it was just a big disparity that I seen. And I was like, wow, like I have, interns that are not saying anything in meetings. They just kind of hold their head down and go home, or, they're not really trying to engage with anybody, or they're asleep at their desk, and then they're wondering why they don't get a job opportunity afterwards, because they're not really taking full advantage of that. And then I've had interns that, show up not in professional wear, and it's not because they're defiantly doing it. It's because maybe they weren't told this is what you need to do. So it's just kind of like we see that kind of lack of, just as people transition into the professional world. So that's why I created Young Black and Professional. So the goal of the podcast is to, I interview a lot of senior level professionals and just kind of talk about their journey and things they wish they would have known on their journey. And honestly, like a lot of it is a lot of the same things that I hear all the time. And then kind of with starting the Public Health Club, one aspect is that career development specifically for public health professionals. So I'm doing like, different trainings and things. And I think that we definitely need to think about how we're continuing to engage with the public health workforce and thinking about things like burnout, because that is huge, especially like in healthcare in general. And then of course in public health too. So that is something that I'm seeing a lot of people quitting jobs because they just can't like anymore mentally. And then just kind of thinking about what type of resources and career development and ongoing training is out there for professionals that are looking to, increase their positions or increase their salary. So like I'm doing different like trainings within the club. So we did a resume development workshop. We're going to have a networking workshop coming up. And then I'm also doing a training on Tuesday. It's going to be focused on how to increase your public health salary. So like just kind of thinking about those type of things that I've learned on my journey and how we can continue to pour into professionals, not only that are currently in school, but that are just kind of in those early career development stages. Because a lot of times it's just kind of like, okay, now you're in the world alone, go for it. So, what resources can we point people to? And then, my resources is the only one out there. There's so many amazing resources out there, but a lot of times people don't know about them. So it's, how do we get people to really know about those resources? So I can talk all day about it, but I'm gonna stop right here. Those are my thoughts.
And Aaron, would you like to add to that as like a recent graduate? Were there any resources that kind of like really stood out to you, or were there things that were helpful as you were thinking about transitioning out of your MPH into the workforce while you were a student that could be helpful to other people listening?
Yeah, I would say there weren't necessarily any specific resources. I think that I can, call upon right this moment. But I will say one thing that held true throughout my job search and even during my time at grad school that I think helped make me more equipped throughout the job search is leaning into the mentorship, as I mentioned earlier, just and specifically the mentorship of Black women. Like Black women have been so critical in my professional development. But even, in addition, I have sought out the leadership in thought of many Black men and minority men at large. So I would say just lean into those who, you see yourself within, really. Because many of us share such common experiences. That's what I'd share.
And I'll add and say that mentorship is so important. It's so crucial. And then, one of the things that I had talked about with someone was just kind of having a mentor. And then I think that they termed it I forgot what the term is. I can't think of it right now, but I think it was more so like an advocate, having someone that really advocated for you in certain spaces, not someone who only gave you advice, but also they spoke your name in a lot of different places. So having someone like that, but then also recognizing that not everyone is a great mentor, even though they have, high status, great credentials. Not everyone is cut out to be a mentor, and that's okay. Look at what they're doing, learn from them, but realize that not everyone is going to make a great mentor. And the beauty about mentors is you can have multiple mentors. You are not pigeonholed into having one mentor, two mentors. You can have as many as you want. So just, continue to increase those connections, because just to, echo with what Aaron said, like, knowing people can take you so much further, and just getting their insight into the public health field, into what they're doing, can take you even further.
I would add, be bold. Like, reach out to people who you're afraid to reach out to because you're intimidated and you feel like they won't talk to you. Like, especially if you are a student, people do want to talk to you because, I mean, quite honestly, like, students are the future of public health. Um, so yeah, be bold. Be really bold.
Yeah, I tell my students this all the time, that a lot of people are like, I don't want to bother anybody. I don't want to get in their way. I don't want to annoy anybody. What if they don't want to talk to me? And I always give this, visual. Let's say you're in grad school, and I say, what if somebody was an undergrad, wherever it is you went for undergrad, and they reached out to you and they're like, I see that you're doing public health things, and that's so inspiring and so awesome. And I see that you went to XYZ University, and that I've really wanted to go there. And would you give me just a few minutes of your wisdom and advice about your amazing career? Like, wouldn't you take pity on that person, first of all? But also, wouldn't it be sort of flattering? Like, wow, somebody kind of looks up to me. Wow, that's. Also, you are going to get to talk about yourself, maybe. The person's going to listen to you and ask for your advice and guidance. Most people do like to talk about themselves sometimes. And so to have somebody who's actually interested to listen to like your journey and advice is a good thing. So I always tell students, you're not bothering anybody. You're giving them a gift. You are giving them this opportunity to, first of all, talk about themselves, right? But secondly, they have nostalgia because they went to your same school or whatever else you have in common, right? And then, you're also making them feel really good that they're helping the next person. And then so I get everybody in the room. I'm like, so who here would do that? Would you talk to somebody from your school? And everybody's like, some people are raising their hand. I'm like, everyone has to raise their hand right now. I'm really serious because I'm going to come calling you next, right? When you graduate and you have an awesome job, I will send students to you, and you will be saying yes to talk to them and give them your wisdom, because that's how this works, right? We help each other out. We're not competing. Public health is not that type of a environment. People really, I find in general, I don't like generalize too much, but I would say just about every single person I've ever met who works in public health is pretty awesome. Usually they're pretty kind. They're usually wanting to make the world better in some way. And so the odds are pretty good that whoever you reached out to who works in this field, they're probably a pretty nice person. They probably like helping others. And they're probably going to be delighted if you reached out to them for advice. And definitely the student thing is 100% right. People love students. It's adorable. They're not to be condescending, but they're like, a student reached out to me. Wow, it's very special. So while you have that, make sure you use that advantage for yourself.
And I would add to that and just kind of make sure that that there is a right and a wrong way to network. So when you reach out to someone, I love Heather's example of how she said, like, to reach out, like, I went to your same school. I'm following your work. Like, I see you're doing X, Y, and Z. I cannot tell you how many times I've had people reach out to me on LinkedIn and just send me their resume and ask for a job. And I'm like, what? Like, I don't know you. So, don't do that. You recognize that these are people too. Like, people have feelings, they want connection, they want genuine connection. So make that connection. And like she said, I echo that. Like, people love to talk about themselves. They love to talk about their journey. And granted, you may run into some people are just too busy and they're just, and that's fine. Just keep going. Move on to the next person. But you will find somebody that is going to want to talk and share about their journey, and they could become a great mentor or a great friend or just a great connection to have. So go in, with an open mind of really learning about them, letting them talk, and then, just kind of building that relationship. Don't really go into it thinking about what can I get out of this? I want to give them my resume so they can get me a job, or, I want to ask them for a job, or I want to ask them for this, for that. Like, don't go into it like that, but just go into it with an open mind and a genuine interest in wanting to know what they have going on. And like she said, a lot of people in public health, I will say 99% of the people people that I've met, they are genuinely passionate about their work. They are kind people. They are really great in doing what they do. And they want to share. They want to work with people. They want to share with the community. So you're going to meet a lot of amazing people in this field. And I'm pretty sure you all probably have, just depending on where you are in your career, but just kind of go into it and make sure that you're having that open mind, and that you're just willing to learn and just, build that connection and that relationship.
Yeah. And I also, I think, your statements, Desiree, really bring up some thoughts alongside Heather's statements. I want to point to something Heather said earlier about applying to jobs, right? A lot of people fear applying to a job because they don't feel like they might fit 100% of the criteria. Right? So they don't apply and they miss any opportunity whatsoever to get the job, right? Think about that in regards to networking or getting to know others within the field. If you don't even try to reach out, there's no opportunity whatsoever that they're going to connect with you. So, and then Desiree, I think, to your point, going into these conversations without transaction in your mind is so important because I think, especially in this field, like we have to work collaboratively constantly. So if you're going into conversations without the desire to learn, that speaks to what you are bringing into the field as well, because these are not just networks, right, that you're building. These are connections with your colleagues, that can carry you forward, and help them carry their work forward, right? I think a lot of students and, early professionals and, many, I imagine professionals actually are afraid to do these things because they're like, what do I have to offer? You have to offer your perspective too, and that's valuable.
And I think too, just kind of adding on to that, Aaron, like that was great. And I think that one of the things to keep in mind about public health is that even though it's a lot of people working in public health, the community is still small. You're going to run into somebody that knows somebody that knows somebody that knows somebody else. And whenever I am, I was a project manager for a while for a consulting and management company. And whenever I would do hiring, I would notice like, oh, this person worked at such and such. I know somebody who works there. Let me call them. And I would literally call them. They're not on your reference sheet. I would call them because they're a friend or they're a colleague. And I have had people tell me, no, don't hire this person. Like, no, they're not a great fit. Don't hire them. They left the job. They didn't say anything, just like random things. But it's important, so important when you're in your career field, do not burn bridges, regardless of the things that you are facing. If you have to leave, give your 2 weeks notice, leave everything in order, all your files in order, do everything that is asked of you, and just leave and cut ties that way. But do not burn your bridges in public health, because the world is small in public health and you really do not know who knows someone else and who can prevent you from getting another opportunity.
Loving the discussion, and I know we could go on for hours here, but we only have 8 minutes. Could you believe it? 8 minutes left. So I'll try to fit maybe one question, and if anyone has a question on YouTube, feel free to drop that in the chat there. But I really, really appreciate all of that, and I think those are great insights that people really need to take going forward, and knowing that networks are just relationships that you're building. So like really be intentional and authentic in building those. So pivoting a little bit. What do we need from both employees and employers to ensure we drive diverse individuals into careers in public health?
I think this immediately comes to mind. Be real, like especially if you are, I'm trying to think of how to say this, right? There's been many jobs that I have declined because I'll talk to someone who I know works there. And, similar to Desiree saying, some people will tell you, don't hire this person. People have been like, do not work here, right? And I mean, I think one of the big elephants in the room is that during a lot of interviews, people are lying to you. Like they're selling you a false narrative of the work. So I would say honesty is a big one, right? Like reach out to people outside of your, maybe your hiring or interviewing team to understand the dynamics of the work that you may be involved in. And then I think in terms of, support for a more equity centered and minded workforce, like actual retention tactics. Like I ask your employees what they are looking for. Ask your staff what would be helpful. I think a lot of times there's this notion that like um you can just, throw together some wellness events or offer a little bit of extra money for a specific thing, or like, ask your staff what they need. And if you see that people are drowning, help them. I think sometimes there's this like, you know, this competitive, as much as public health is very collaborative, there's also very much so competitive undertones that we really need to call out and talk about. Um, and I think that especially for a lot of, young professionals and people of color in this space can be really like intimidating. Um, so I hope that answers to some extent, and I can, I guess, add as others share.
I would say for employers, one of the things that I definitely think that, could work better is if people that are in managerial roles that are leading people, are actual leaders. Instead of trying to tear people down or trying to compete against their employees, because I have seen that happen. I've seen people in manager roles take credit for their team's work, and not give their team any credit, not talk about them. They just take their work, and I've seen what it does to people. Um, it creates a terrible environment. I am a fan of, in certain organizations having skip level meetings. So like we're meeting within, if you're an employee, have a meeting with someone who's above your manager to really kind of talk. And it's just a one-on-one. It's an open discussion about how you feel your manager is doing. And just kind of having that openness and that transparency, so things can get better. So I think that it's a lot that needs to be done, because I do feel like a lot of times we're only looking at people's experience and we're not looking at their character, or we're not thinking about their team and wondering, okay, even though, let's say, even though that State Department has a very low retention rate, for employees, what specific teams have the lowest, what specific teams has the highest amount of turnover, thinking about that, and then trying to understand, okay, let's see why this team has the highest amount of turnover. Why are people leaving? What is the reason? And really trying to implement some real strategies. And I think that we're not focusing in a lot of resources on retaining staff in public health. We're just not. And I don't know. I think that a lot of times, we have a lot of priorities was focused on specific grants or whatever, wherever our funding comes from. We have to make those things a priority. But in that, a lot of times we lose great employees. Or we're just not retaining them like we should, and then we leave a bad taste in their mouth about local health departments or about state health departments in general. Um, I do think that for employees, what we need to do to drive more diverse individuals into the field, I think that we need to be more transparent, kind of like Aaron said, just kind of be more transparent about the challenges that we face within our role. So that was one of the reasons too I created the Public Health Club, so we could have candid and open discussions about the real things that we're dealing with in our jobs. Because like I had mentioned earlier, burnout is huge. And I see people on LinkedIn a lot. I've seen some of my colleagues on LinkedIn, and they're just talking about, like, I see them going from talking about how great their new job is to a year later, they quit that job and they're talking about, all of the things that happened that we didn't see, all of the microaggressions, the whatever it may be that have happened to, make their job just terrible. So I think that having transparency, and making safe spaces within roles for people to talk, and then for people to talk about to interns or to students, so they really know what to expect and how to navigate that. Because certain situations, like, you're gonna face, like, regardless of where you are, but you have to know how to navigate it. And knowing how to navigating it, having a support system can make all the difference in you getting through that and getting to the next level and really utilizing that job to get to that next level in your career. So knowing that you're not alone and really finding your community and your network is a big deal, I think, for employees, for future employees as well.
I think that you both summed it up really beautifully. So I don't have a ton to add, although it is there are some efforts that are out there. The CDC has some programs that they've run for a long time that are like Summer Public Health Scholars is a program, for instance, that we have at Columbia, and a couple of other places have programs like this where they will take, you know, students in undergrad who are from diverse backgrounds, people of color, and bring them in to have just a summer exposure to what public health is. They take a couple of classes in public health, they do an internship, and it's just like for most people, even after COVID, right? Like their eyes have not been open to what this even is. Most people still don't know what an epidemiologist does. They, you know, really, they just don't know. So just having that exposure so people know that this is a really good field and that it's really important, I think is part of it. But I feel like what sometimes doesn't happen is that like you kind of have to stick with somebody to bring them into this field and to keep them engaged and make sure people feel included. That's actually the place where things sort of fall apart, just like you said, is that, you know, everything looks great on paper or in the job interview, exactly like you said, people are trying to market themselves. But do they really have a culture where everyone is included, everyone is valuable? There's a community or an employee resource group for different people with different identities where they can come together and share what's really going on. Do the managers and supervisors really, you know, if are they in the right place to be, you know, mentoring? And occasionally they're not. What can I say? Like there are people that really shouldn't be managers and they get moved up into that, and it's not always a great situation. So I feel like there's some structural change that does still have to happen internally to some organizations to make sure they're actually inclusive and that people, you know, and it's a question you could ask in a job interview, depending on how you feel, or like at least before you accept the job offer, you can always ask like, what does your organization do when it comes to diversity, equity, and inclusion? Do you have employee resource groups? Do you celebrate people's different identities in an inclusive way where people feel like they're part of this group and this community? But anyway, there's a lot of work still to be done, as I'm sure you all know. But yeah, there's a lot that we can still do.
And one thing really quick, because I know we're like low on time. Just to add to that, those questions that Heather was saying, like you can ask a lot of different questions in a job interview, but sometimes they don't always tell the truth. And sometimes you can see through it because you will see the looks and expressions on people's faces when you ask certain questions. I will say that I remember a couple years ago, I had an interview for a very large public health organization, and I asked them, what does diversity, equity, and inclusion look like within your organization? They kind of like, I could see people like pause, no one really wanted to answer. And then they said, this is the answer that they gave me. There was like, oh, well, we value everyone's opinions. I said, oh, okay, thanks. X off the list. So, you know, just kind of thinking about that. I think they've gotten better now, I think. But you know, it's just something to kind of think about. You know, you really do want to go in a place where you are valued, where your opinion is going to be valued and you're really allowed to grow in a healthy way.
This has been a wonderful, enriching conversation, and I think it's just the beginning of the conversation that needs to continue to have. To close us out, I did have one last question in the chat that I would like to ask to you also. The question is from Carice, and she asks, what do you think is the most transferable skill that you think you have brought to the work in the field?
I'll go first. I think for me, it's been program management, because I've been able to transfer my program management skills into so many different areas. Because as a program manager, you know, I may have a evaluator that I work with, but I'm also in the evaluation discussions. So if I needed to do evaluation myself, I could do it for my program because I know the metrics, I know what we're looking at. So I have that overview of that. Also, as a program manager, I'm looking at our budget. I'm looking at, you know, our contracts that we have with certain organizations. So now I have contract management skills. I have financial skills as well. And then also, I was very easily able to switch my program management skills into project management skills. So just kind of, you know, a lot of those skills that I had were very transferable. So I definitely think that program management allowed me to kind of do like a catch-all because I did do some data analysis too. I worked with a lot of people in doing that. So I was able to really touch a lot of different areas, which of course translated pretty well in various aspects of public health.
I think for me, well, I kind of want to highlight something. So I feel like oftentimes there's a really big push for like technical skills, right? Like you need data analysis, you need to know R, you need to, know Stata, so on and so forth, which I do think is very important. And of course, I think the skills necessary differ depending on where you find yourself. But I do think sometimes there's not as much emphasis on like people skills, like being able to really interact with people and not just understand their positionality to your work, but how their positionality, fits within the scheme of your organization or your or the sector, so on, or so to speak. Like I found myself really leaning into relationships more than I have like hard skills, like building a lot more relationships in my work than I have like, using R. Not to say I haven't, but like, day to day, you're interacting with people. So just, make sure that, you're comfortable doing that. And doing that in a way that's like very, yeah, reflective, right? Um,
And a quote I heard to add to that was hard skills will get you the job, but soft skills will get you promoted.
exactly.
Points. I would say weirdly I started out my first job after grad school was as a grant writer, and I try not to say that out loud because people will take full advantage as soon as you let them know that you can write a grant proposal. So I switched careers after just 1 year after grad school, and I pivoted into higher ed career services. It's a random story, but I kind of got thrown into working with students and helping them do the resume writing. And as I started doing that, I was like, okay, I'm going to go out and get coaching credentials because I really don't want to mess anybody up by giving bad advice. So I read all these books and I got additional credentials. But what I carried over with me from the grant writing was basically the resume writing is the same idea completely. It was almost the same skill because it was, how do I convince you, the person reading this document, that you should give me money because I will do a great job at delivering some impact for you? Same concept with grant writing as it is for resume writing. And so I feel like that persuasive writing skill has come in handy a lot in various different ways over the years. But I mean, you would be amazed the type of career changers that I have seen over the years and how unbelievable some of their skills have easily translated from things you would never connect the dots. It's just, I had someone who was a theater lighting specialist, right? She worked in like in theater, and she became like an emergency response person, and now she does humanitarian type work. And I was like, well, how do we connect this? And she was like, well, you had to work under pressure. If the lights broke at the theater, you had to fix that in that very instant under total pressure, like 1,000 people are waiting for you. So you can keep calm and fix a technical issue under pressure. So like these things seem totally unrelated, but they kind of weren't. It was like, the show must go on, whether you are in a humanitarian crisis situation. Obviously, they're totally different, but those skills translate. So you, believe it or not, probably all have skills, whoever's listening. You have skills, you just maybe don't know exactly where they fit, but they fit for sure.
Thank you, thank you, thank you so much, Desiree, Heather, and Aaron coming on today and sharing your expertise. Everyone's profile on LinkedIn should be linked below if anyone does want to connect with either of you and continue this conversation. So be sure to click through and connect with each of them. But I greatly appreciate you all taking time to talk more about the future of public health and end off National Public Health Week with me. So thank you all so much. And I appreciate everyone that tuned in as well. Be sure to share this with someone who'd also get some value from this conversation. I appreciate you all, and you will see me before National Public Health Week next year for sure. So thank you, everyone.
Thank you. Nice meeting everybody.
Okay. Awesome.